Understanding ice and heat therapy.
Ice and heat are common treatments for exercise injuries, but they serve different purposes. Knowing when to use each can help you recover faster and reduce discomfort. Ice helps by reducing swelling and numbing pain, while heat encourages blood flow and relaxes muscles. The right choice depends on the type and timing of your injury.
When to use ice.
Ice is best for recent injuries, especially when swelling or inflammation is present. Applying ice within the first 48 hours after a sprain, strain, or bruise can help control redness, swelling, and sharp pain. Use an ice pack wrapped in a towel for 15 to 20 minutes at a time, allowing your skin to warm between uses.
When to use heat.
Heat therapy works well for muscle aches, stiffness, and chronic pain, especially after the acute phase has passed. Applying heat increases blood flow, loosens tight muscles, and eases soreness. Use heating pads, warm towels, or baths, but avoid heat on recent injuries or areas with swelling, as this can worsen inflammation.
Common mistakes to avoid.
Avoid using ice or heat for too long or directly on your skin. Never apply heat or ice for more than 20 minutes continuously, and always use a barrier such as a towel. Do not use heat on fresh injuries where swelling is present. If numbness or severe pain occurs, stop treatment and seek medical advice.
When to seek medical help.
Most minor exercise injuries can be managed at home, but watch for signs that need a doctor's attention. Seek medical help if you experience severe swelling, persistent pain, inability to move a joint, or if there is visible deformity. Proper diagnosis ensures you use the safest and most effective treatment for your injury.